On to South Africa now, which has entered a level 3 lockdown as coronavirus continues to wreak havoc across the country. The President Cyril Ramaphosa made the announcement on Thursday. Listen in.
Surge in new infections means that we must once again tighten restrictions on the movement of persons and gatherings. We need to enforce compliance more rigorously, and we need to take firmer action against those who do not adhere to the regulations that save our lives. In view of the rising infections, the Cabinet has therefore decided to move the country to alert level 3.
Now, under these new restrictions, there will be a night curfew in place from 10 p.m. to 4 a.m. and non-essential businesses like gyms, restaurants and bars will be shut down an hour before the curfew to allow the employees to return home. Public gatherings have also been capped to maximum 50 people indoors and 100 outdoors. South Africa is the continent's worst COVID-19 affected nation. It has recorded over 1.76 million COVID-19 cases since the onset of the pandemic, and nearly 60,000 people have lost their lives. In the last 2 weeks, active cases have almost doubled in the nation, and hospitalizations have increased by nearly 60%. If the situation wasn't grim enough, South Africa's vaccination drive is also moving far too slowly than required. In the country of almost 59 million people, only 2 million have received a dose of a COVID-19 vaccine. President Ramaphosa, however, is optimistic that the vaccination drive will pick up pace.
Now that the delays in the supply of vaccines is largely resolved, our immediate task is to complete the vaccination of all those over 60 years of age without delay. It is estimated that we have the capacity at present to vaccinate at least 150,000 people a day, and we are planning to increase that to 250,000 a day as soon as possible. I would prefer 300,000 a day.
For more on this, our South Africa correspondent Galden Ongmu getting us the latest.
Alert level 3 lockdown for South Africans mean a stricter rules and regulations amidst the third wave. Several hospitals around the country, mainly in the Gauteng province, are already complaining of shortages of beds. Currently, there are 3 variants that is doing its round in the country, but the main form of variant in South Africa is the 501Y.B2 variant or the Beta variant. Experts have said that it is not yet known how long or how severe this wave will be. At this moment, the biggest concern for the country is slower than anticipated vaccine rollout and its supply. The country has already been adversely affected by shortages in the global supply of vaccines, which has hampered vaccination programs across Africa and in many other lower and middle income countries. However, President Ramaphosa has reassured its citizens that they are planning to increase vaccinations from 80,000 to over 250,000. As of June 15, South Africa recorded over 8,000 new cases, around 1.75 million positive cases, and over 58,000 deaths. This is Galden from Johannesburg, South Africa, for WION World is One.